Final Shark Tank pitch comes from Rushford, an agency of Hartford HealthCare. A leading Connecticut provider of addiction and mental health treatment, Rushford is recognized for their high-quality programs. And now they're in the technology business, which is a bit of a switch. TryCycle is a cloud-based technology platform that creates a digital tether, I like that, between treatment team and patients in the spaces between scheduled visits. TryCycle collects, processes, and scores patient insights, trends, and patterns. This real-time data gives staff a chance to intervene when TryCycle detects distress. It allows Rushford to get upstream, to intervene before an emergency. And when a treatment team member reaches out, patients consistently report being reassured and pleased. Joining us today is Clinical Program Manager Michelle. I'm going to turn it over to you, Michelle.
Thanks. Greetings, Sharks. Did you know the coronary heart disease is down 51% since 1972? And infant mortality rate is down 90% in the last century. But did you also know that depression and suicide are currently skyrocketing? Opiate deaths through the roof. And alcoholism, forget about it. It's off the charts. The sad thing is high death tolls, nothing new in behavioral health. In fact, death by opiates alone in 2019 was almost 50,000. Why are other medical fields capturing effective treatments and curbing diseases while addictions and suicides are escalating? We can impact diseases like addiction and depression with innovation programs like TryCycle, a HIPAA-compliant digital mobile intervention that allows clients to self-inventory and journal, to alert coaches if they're at risk, and to communicate with their entire treatment team all at once. It is literally saving lives. Well, thankfully, we implemented TryCycle just before the national pandemic hit. COVID, it was like iron gates slamming shut on those that were already struggling. We had masks, sanitizers, increasing anxiety and increasing depression. Now, in isolation, that's like krypton to those in recovery. But because of innovation, because of TryCycle, we had 2,000 interventions in the 5 months following the start of COVID. That's 2,000 times that we could not have known that people were at risk prior to TryCycle. You know, we can do some amazing things in medicine, like we can do heart transplants. Why can't we impact addictions in the same way? Well, we can, and here's how. Traditionally in behavioral health, we ask clients how they're doing, and they say fine. And then we cross our fingers, we say a prayer, and we send them on their way. We hope they come back the next day. It's actually quite curious. So let's pause a minute. I want you to think about going to your cardiologist. When you go in, you're not expected to understand how the heart works, yet we do kind of expect people with brain disorders to override their thinking before they actually understand their thinking, before they actually understand that the disease they have is their thinking. We know that behavioral health clients need connection, not only to survive, but merely to survive. You know, isolation is death. Yet in the pandemic, we were told that to isolate is to survive. It's so confusing. The antidote to isolation is connection. And the secret sauce is TryCycle and Recovery Coaches. Well, how do you connect with recovery coaches during the pandemic? With TryCycle coaching, that's how. With TryCycle, clients they can release it, they can own it, and they can share it. And then presto, superhero sober supports reach out, check in with clients, and the whole team is updated in a matter of minutes. Now, using our intervention technology, we can take an inventory and we can turn it into a risk prevention alert, interrupting relapse, overdose, and death, and yes, even in a pandemic. But wait, there's more. With our graphing capabilities, patterns can be detected, unearthing that at Thursdays at 7 p.m., it's a high-risk moment. That's right, Mr. Client, that's when you and your ex swap off your kids. But you blocked that out, you forgot to mention it, putting yourself at risk without even knowing it. But we've got your back. When a client relapses, we take that at face value. Oh, you relapsed on Saturday because you used on Saturday. But that's not when you relapsed. You relapsed 4 weeks ago when you stopped taking your medication, you stopped going to meetings, when you started to feel irritable. You didn't pick up on patterns, and so we didn't pick up on patterns. But wait, are we asking our clients to be the experts here when they have a brain disease that tells them that they don't have a disease? To our clients, We can now pick up on patterns and teach you your patterns so that you understand how the disease is manifesting in you and how to beat it. With TryCycle and coaches, clients aren't expected to be experts on their disease on day one, just like we wouldn't expect Johnny Client Man to be an expert on cardiology if he has a bum valve. Johnny looks to his provider to lead him. And with TryCycle coaching, we now can too. All that is needed is a phone and a few minutes of your time to text and talk into the phone for a journal entry, to create a connection, to flag a risk, and most importantly, to prompt an intervention. Did you know that with TryCycle coaching, our clients are staying in treatment longer? And did you know that with TryCycle coaching, not one of our clients died from overdose or suicide in 2019, 2020, 2021. We can do better. In fact, we are doing better. Innovation, saving lives.